Well, Piskin, we did talk about missing teeth and all the havoc they can create in a person's mouth. Besides of bad looking, besides of like teeth next to each other starting to get loose and shifting, and then that makes a bad look. But also you mentioned headaches, neck pains, shoulder pains, even ugly looking, and nobody wants to look crooked and ugly. And it always, you said it all comes so slow that sometimes you just don't know. It's the dimmer switch example. It just happens and you don't notice it. And one day when you wake up and you go, I have a crooked mouth, or like, gee, I had headaches for a long time now, or whatever. So the point is, you talked about that. Now, what are some of the ways of replacing a missing tooth? Has technology changed there? Are there some real nice bang ways which can be done, and other choices? Tell us about it.
Well, years ago, if you had missing teeth, it could be front or back. You had choices where you can replace them with a bridge where you need other teeth to anchor it together, or you had something that came in and out and was removable. People call that a partial denture, and that functions very well to help those patients. But today we do have some significant improvement and wonderful technology with what we call dental implants. And dental implants can replace from one tooth to all your teeth and give you back your function of chewing and have something that's not removable, and also give you the ability to have enough force to chomp and mush your food, where when you had something removable like a denture or a partial, you didn't really have the same ability and the same force to chew your food. But now they actually feel like your own and function like your own. So the technology today with dental implants is amazing, and it's pretty routine today in dental offices, and especially so we can replace teeth with implants and put back what's been lost maybe years ago, and balance the way the teeth mush together and the way they bite together, and get that puzzle corrected, and patients feel like it's their own.
Tell me, Dr. Piskin, what is
Yes,
the major difference between, we all know a crown and a bridge, and we have heard about implants, but shed some light on what's the major difference between those two things, and is one completely obsolete, like the crown and bridge? Is it completely obsolete, or does it still have a time and a place?
No, neither of them are obsolete. The idea of a crown is a term to describe replacing missing tooth structure, whether it be a front tooth or a back tooth. There's a variety of types of crowns, but today we're doing more.
Actually, I misspoke here a little bit. A bridge and an implant.
The crown part is still, the bridge. If you have a wonderful, strong, healthy tooth in front of a missing tooth and one in back of a missing tooth, years ago we would have to remove good, healthy tooth structure to be able to replace that missing space with a bridge, and it would be held in by those other two teeth. But I always feel like if we don't have to touch good, healthy tooth structure, let's not. And today, with the ideas of implants, we can take the tooth in front and back that are perfectly healthy and not ever touch them, and be able to replace that missing tooth with a single tooth implant. And then when the implant is placed, then we can make a beautiful crown that's held in by that implant and match it to the other teeth around it. So no one's going to know that you ever had a missing tooth there. And those other teeth around them will be so happy, because now they can't shift anymore and they can't move, and the upper tooth can't grow down, because we have a replacement in place that's permanent, not removable.
Okay. I see. And what about lasting? Does a bridge last as long as an implant, or is there some data out there about how long, once you put it in, how long does it last before you have to redo it again?
Well, the implant itself is replacing the missing tooth. It's the foundation of what we're doing. And once you put the implant in, the success of implants are in the 98 to 99% success rate. Once that's there, it pretty much will be there for the rest of your life. It becomes part of your bone. What goes in the implant, where the crown is made, just like the bridge, the success and the longevity of these is amazing. We have very strong porcelains today that they can withhold up for long periods of time, for many years, and they don't chip anymore. Look, if someone's going to bite on a big piece of ice cube or some big rock candy thing can break, just like it can break your own tooth. So it all depends upon, of course, what they're chewing on. But normal functioning and everyday life, these bridges and crowns on implants can give many, many years of service, more than anything we ever have. You know, if someone goes and buys a car today, they buy a car every 4 years, 5 years. You know, we have crowns on implants or bridges in people's mouths 20, 30 years. I'm not saying everybody will get that success, but that's an amazing thing.
Let me say, so an implant or a bridge, is there one which lasts longer for whatever reason, the whole structure before it has to be redone? Is there one which lasts longer or less longer, or do they both last forever, more or less?
Nothing lasts forever. That's very clear. We don't last forever. But I think as far as your question, I think the crown on an implant will be probably a little bit more longevity, because you're not putting stress, or you're not asking other teeth to help hold it in. And it's like a bridge. The San Francisco Bridge is being held in by land on both sides. If something happens to one of those pieces of land, that bridge is failing. In this case, we only have one implant and one tooth. The bridge is multiple teeth that would have to hold in the false tooth. So I would say today the longevity is implants with a single crown.
Okay, all right.